Hi, I'm Dr. Monica Webb Hooper, Deputy Director of the National Institute on Minority Health and Health Disparities at the National Institutes of Health. The COVID-19 pandemic is on the minds of many, and specifically the COVID-19 vaccine. This pandemic has affected the lives of millions of people in the United States and across the globe. It is now one of the leading causes of death in the country. It has also created new health disparities and brought to the forefront social inequities and health disparities that have existed for many years. When we look at COVID-19 cases, hospitalizations, and death rates in the United States, the consistent findings are that African Americans, Latinos, and people from indigenous communities are experiencing a higher burden when compared to the majority population of white Americans. We are all at risk of infection because COVID-19 is spread mainly through person-to-person contact, so within about 6 feet, and specifically through respiratory droplets produced by coughing, sneezing, and even talking. A person can be exposed in many ways, and a few examples include being in close proximity to people at work, while using public transportation, places where people are gathering, or even at home. Racial ethnic minority individuals are also more likely to live in homes with multiple generations of family members, like my grandmother's home, where she may not leave home, but my cousins may spend time outside of the house for work. Families and communities being intentional about minimizing opportunities for these exposures is key to staying healthy. The bottom line is that we have a great need to end the COVID-19 pandemic for everyone, but we also need to pay particular attention to populations that are facing an undue burden. Now let's talk science. There has been lots of excitement about the first COVID-19 vaccines becoming available and hopes that a large percentage of the population will receive the vaccinations by late spring or early summer of 2021. But not everyone is sharing in the excitement, and it's largely due to concerns about accepting the vaccine and the potential for harm. I understand where this hesitation and fear comes from. I do, based on my own lived experiences, those of my family, and what I have learned through my research. I resonate with and I understand the hesitation and the strong distrust for participating in clinical research and for this new COVID-19 vaccine. But I trust science and scientists. I trust data and evidence. I am a community engaged researcher myself. I've studied minority health and health disparities for over 15 years. And as the Deputy Director of NIMHD, I know that clinical research is an important component to understanding this disease and its many impacts on physical and mental health, and for the discoveries that are needed to move us to the other side of the pandemic. I also trust that the regulations that are in place for human participants in research provide protection to keep us and our data safe. And importantly, this medical advance, the COVID-19 vaccine, is critical for us to put this pandemic in the rearview mirror. Priority for me and for NIH is ensuring that we do everything possible to reduce COVID-19 and other health disparities. The data show that African Americans and other racial ethnic minority groups are more likely to say that they would not join a vaccine trial or are not willing to accept a COVID-19 vaccine if it was ready today. So I was pleasantly surprised to learn that my own parents-in-law had enrolled in a COVID-19 vaccine trial and are going through the process. Today, I wanted to share a conversation with my in-laws about their experience as research participants in a COVID-19 vaccine trial. For more information about COVID-19 clinical research opportunities or to learn about the COVID-19 vaccine, please visit covid19community.nih.gov.